Welcome back. Before the break, we were talking to our distinguished guest today, Dr. Nashaba Matin, a consultant physician at Royal London and Barts Health. Dr. Nashaba, we had just got into the rhythm when the commercial break hit us.
That's right, yeah.
We were talking about HIV epidemic in Bangladesh, and you said that it's concentrated in high-risk population areas, and the reasons are injecting drug users and among the migrant workers. See, when you say HIV epidemic, what makes an epidemic? I mean, is the incidence is 10%, 20%, 50%?
Oh no, not that high. No, no. But yes, that would definitely be classed as an epidemic as well. But in general, an epidemic is defined as having an incidence of cases that is outside the norm that would be expected for a particular area.
Right.
Generally speaking, with HIV, particularly in Bangladesh, it is actually relatively low prevalence amongst the population. So prevalence will run at much less than 1% of the population. But within certain groups of high-risk communities in Bangladesh, we have a much higher risk of HIV. So as you've mentioned, the injecting drug users in Bangladesh, some of the sex workers, and also the migrant workers. So as you know, Bangladesh has a big population of mainly men, but also some women who work overseas, often in the Middle East or in India and other places. And often for them, when they work away from home, for a number of different reasons, they will acquire HIV while they are away from home. And then when they return home to their families,
they pass it on.
They bring it back and they pass it on to their wives and then sometimes on to the children as well.
Right. Is there an effective education system, I mean, for informing people that how to avoid getting this disease, how to avoid getting in contact with such people?
So, I mean, obviously there are lots of work that has been done, and some people have argued that that's one of the reasons why Bangladesh has been more protected from the epidemic, because the epidemic in Bangladesh is far less than the epidemic in India, for example, which is essentially next door.
But ours is a small country.
Sorry?
Ours is a small country,
yes,
we have lesser number of people.
But very densely populated, and obviously the border between India and Bangladesh is porous, and there is big rail and road routes that go between the two countries. So the expectation previously was that there would be an explosion of HIV cases in Bangladesh because it would follow from India, and actually that didn't happen, which is a good thing. But there is definitely a much higher incidence of HIV in certain populations, though.
You mentioned that there was limited infrastructure in place to provide care, or probably any care at all, you see.
Yes.
What do you really mean by that? I mean, is it still only in Dhaka or in Sylhet or other places?
So HIV care in Bangladesh is predominantly available in Dhaka, but also Sylhet, Khulna and Chittagong there are only certain places where you can access the care. So for some patients that would mean travelling very large distances, either once a month or once every couple of months, to get medicine or to get blood tests or to see a doctor. And as you can imagine, for some patients that travelling those large distances is very expensive, very time consuming, very difficult to hold down your normal day-to-day job if you're having to go for frequent hospital visits. So it's very challenging.
It's maybe a silly question to you, but it comes to my mind that when somebody contracts HIV, how long has he got to live? I mean, is he saying goodbye to the world, or what?
That's a very good question. I'm really glad you asked me that question. So in this country, if you have HIV, if you are diagnosed early enough and you start taking medicine and you take your medicine regularly and you control the infection, then you will have a normal life expectancy. Okay? So I always say
and avoid the reasons that got you into the mess.
So you will have a normal life expectancy. You will live, and you will live well. So you can go to work, you can go to college, you can get married, you can have children, you can do all of the things that you want to do. Nothing will stop you. The treatments that we have for HIV are very good. at controlling the infection so that people can stay well. In the same way we have good medicines to control blood pressure and we have medicines to control diabetes. If you take them and you control your illness, you will stay well.
Somebody who's taking medicine for HIV, suppose he gets married, is he going to pass on the same infection?
Yeah, so another really good question. So the answer to that is not necessarily. Okay, so if they know that they have HIV, if they take the treatment for HIV, if they control their virus, okay, then they will not pass on HIV to another partner, whether that be their wife or somebody else.
Right.
And that means that they can get married and they can have children.
Normal.
Yeah, in a normal way. And you know, I have patients I see in my clinic here in Whitechapel who are from the Bangladeshi population, and that's one of their first questions is, what will happen to me? Does that mean I'm going to die? Does that mean I can't ever get married? I can't have a family? And my answer is no, it doesn't mean any of those things.
I hope there are not too many Bangladeshis infected in.
There are some, but not a huge number, yeah. And a large number of them come to see me, probably because I speak the language, so it's easier for them. But yes, I mean, it's not the biggest, it's not, you know, our biggest cohort of patients is not from the Bangladeshi population.
In Bangladesh, you see, we keep traveling between Bangladesh and London because that's the kind of subject we have today. You said that there is limited training for 2 doctors available, see. What is the reason?
So
the disease is there.
It is, yeah, but it is there, but it's not there in large numbers. So in a medical school curriculum or a postgraduate curriculum, you will cover the subjects or the topics that of diseases that are well, you will cover the topics that are of high prevalence in greater detail. HIV training there is still very limited. They don't see a lot of HIV. The numbers of people infected with HIV in Bangladesh has been estimated at most to be about 10,000. So in a population of 160 million, it's not a large number of patients. So you're not going to be able to devote a large amount of time in your medical school curriculum to teaching about something like that.
But definitely the disease is there.
It's definitely there, yeah.
While in Dhaka, you were also appointed to help set up a unit to train a staff. Where was that?
So that was in the Cholera Hospital ICDDRB that we mentioned before. Yeah. So it's an international organization of international reputation for research, and so they felt that it was necessary for them to have a service for HIV, which they could then use to provide service for the patients, to train their doctors, and also they might be able to do some research work as well.
Yeah, just before we started the program, you were telling me that you taught some of the very senior professors.
Yes.
And, what was the reaction that
I did? Well, yeah, I mean, so that was very interesting.
It was one thing talking about HIV, and then you are talking, a lady is talking, teaching the men.
Yes, you're absolutely right. So, yes, there was a lot of hostility because it was about HIV, and they didn't really necessarily want to learn much more about HIV. They felt that they knew enough about it. And when I used to come into the room, I was female, I was younger than most of the professors who were often in their 50s or 60s. And so, I used to get some rather hostile reception. But generally speaking, after I used to begin the session, I think it was clear to them that actually I had, this was my field, this is my field of expertise, and I had a lot of knowledge about this. And so usually I could break the audience down, and then actually by the end of the session, it would be a bit more friendly. But yeah, it was very challenging.
They ended up being good students.
Yes, yes, in the end, yes. I was a very strict teacher.
Oh, I can see that. What was your role in National Training Program for doctors in Dhaka and Sylhet?
Yeah, so actually that was great for me to do. So that was UNICEF wanted to run a national training program on prevention of HIV from mother to child. So this was about pregnant women and how we can prevent them passing HIV to their babies, which is possible to do. And so I was involved in training professors of obstetrics and gynecology and pediatrics across the country in various institutions. And so we used to talk about HIV therapy and diagnosis and managing patients and managing the delivery and managing the baby after the birth. And all of that is basically to have at the end of that is an HIV negative baby. That's the aim. Yeah.
That's great. After all this, you see, we come to the big question, the stigma and the discrimination. See.
Yes.
What was your impression? What sort of a stigma is attached to such a disease and such patients?
Yeah, so the stigma,
particularly in Bangladesh.
yeah, the stigma in Bangladesh is very real. It's very, very real, and it's a huge barrier to providing good care. And it's a huge barrier for patients to access care, and it's a huge barrier for the population to learn and understand more about HIV. And so I saw that stigma in real time. I saw it from doctors to patients, from nurses to patients, from family members to their own family members who are infected, from husbands to wives, from mothers to children. And it was really, really hard for me to see that actually on a daily basis. And so one of my biggest roles when I was there was to try to break some of those barriers of stigma.
Well, you had to break the stigma, and then we need to take a break.
Okay.
Okay, viewers, time to take a break, and when we come back, we'll pick up the thread and carry on the discussion. Thank you. Don't go away.